think it gives the patient such independence. It gives them freedom. They can choose to do when they want to do their dialysis. They can have a more active life. They feel better.
Manitoba's got the highest rate of dialysis in Canada, and yet we weren't getting to patients early enough in terms of screening and identifying patients early, which has a major downstream effect. If you're referred late, not only your health outcomes are worse, but you're really pigeonholed into doing one kind of dialysis, which is in-center and facility-based hemodialysis.
Facilities are becoming overcrowded. Staff are starting to see long waiting lists for people to get in.
Hi, young lady. How are you?
We were actually out of physical capacity in the city for providing hemodialysis, so much so that, in fact, we were at some times having to send patients that actually lived in Winnipeg to our peripheral dialysis units outside the city, which really wasn't good quality of care and not something as a patient you'd want.
I think we needed to change how we were thinking about it. We couldn't keep building major hospital centers where they would need to have dialysis. So why not get better quality patient care closer to home for as many people as we could?
If they come in center, we'll have to change their status to in center to run once and then go back, and they'll have to put a reason for it. And it's there now, but now it'll be
Historically, from a decision-making perspective, I can say that we haven't always used or based our decisions around research. The extra program, I guess, opened the doors, allowed us the opportunity to really look and review the literature and base our decisions on very robust and very informative evidence.
The extra program makes the organization question why it's doing what it's doing, how can it do it better, and it allows an opportunity for those inquiring minds that know there's a problem and they are interested in the research behind it to actually see something being accomplished and to see and feel the organization getting behind them when they're moving forward on their project.
Okay. And so have you clicked into dialysis yet?
In terms of input and in terms of number of individuals,
what are some of the things that you could do?
That were working on the project in a very direct way.
To minimize the UF, right?
There were about 15 nephrologists, along with nurse educators, healthcare aides, social workers, dietitians, pharmacists, and so forth.
Our patients will be registered in there, but if I think historically with a lot of medical care, patients associate their care with a physician. More and more the culture within our renal program is you're associating your care with a team. You're joining a family.
I'm having a little bit of a problem
and because we have developed kidney health clinics that are multidisciplinary, and also we're able to follow patients very closely. We were actually able to keep patients off of dialysis for a longer time than we used to be able to.
I'm checking my lines. This program represents freedom. I can just live an almost normal life. You just have to figure out how you're going to manage that, and you just make a little plan for yourself.
We first realized that progress was being made approximately a year after the intervention started. We slowly started to see mild improvements in terms of the number of individuals that were actually starting, the incident number of patients that were starting on home modalities.
It looks really complicated, but it's actually not that bad.
And then through time, the number just seemed to increase and increase as every month went by.
If we were trying to provide dialysis in a hospital setting for all the people that are requiring dialysis, we would have had to have built wings onto hospitals. So there's all of these savings that accrue to the health system.
You do feel proud because it's like, wow, I can do all this myself, hook myself up, I'm doing my own care, and it's an accomplishment, definitely.
I think this intervention project has helped contribute to a much more sustainable system. I think it's demonstrated that we could take a very complex service such as dialysis and now provide it in a completely new setting such as in the home.
The CHSRF and the extra program has been an extremely rewarding experience in terms of the ability to take a project and see it through, and you actually see the results in numbers and in patient anecdotes and any metric you can measure success by. Being able to go to the residency sessions and network with other like-minded individuals nationally is an extremely rewarding experience and enriching for helping make better healthcare decisions in the future.
The value of the extra program is that it allows people that are on the front line, that are involved in care or administration, to actually devote some time and receive training, coaching, mentoring in the use of research that might not happen if there wasn't an extra program. I'm quite a supporter of it.